Hello, welcome to Joy Wellness Partners. We're glad that you scheduled your appointment for a regenerative medicine procedure. We hope that you have the most optimal results, and we're going to give you some tips for success to make sure that your healing is optimized. So we want you to avoid anti-inflammatory medications. You want to stop that 3 days to 7 days before the procedure, depending on when you schedule your appointment. 3 days is the minimum expectation. That anti-inflammatory medication would include, any prednisone or any sort of Advil, Aleve, aspirin, naproxen. You can take Tylenol or any other prescribed medications. The only other medication that's really a concern is relative to if we're treating your spine or your neck. We wouldn't want you to be taking any blood thinners for 72 hours prior to the procedure. And that's so that we make sure that we don't have any prolonged bleeding after the injections. Other medications, like I said, you can continue. Let us know if you have any allergies to latex or any other medications, and let us know if you have any anxiety that we can help to calm during the procedure with a pre-medication. In those cases, if you do get pre-medicated with an anti-anxiety medication, you'll need to bring a driver or wait at least 3 hours after the procedure before driving yourself home. If there's any area that has a lot of hair that we're gonna be treating, say you're, really got hairy legs, you wanna shave that area of your knee if that's the area that we're gonna be treating, because it helps us with taping the knee after the procedure. And you wanna be well hydrated. Try to drink a lot of water and don't drink a lot of alcohol for 3 days before the procedure, and avoid smoking for at least 3 days before the procedure. On the day of the procedure, wear comfortable clothing like sweatpants, a t-shirt. If you have a shoulder that's being treated, wear a button-down shirt or something that's easy to get your arm in and out of. You may not be wearing a gown, but you may just want to be able to pull the exposed area of treatment into position so that we can access it easily and it's not too tight of an area for you. So if you have someone else that can drive you home, that is recommended, especially for those areas where we're treating the right leg, the right hip, the right foot, the right knee. Those areas, if we treat the right leg, we want you to rest that area for 3 days, so we wouldn't necessarily want you to be using your driving leg. If you if you have crutches that are suited to you, bring them. Otherwise, we'll provide you with crutches. We have small, medium, and large crutches to accommodate. Those crutches are sometimes useful for people that are getting their lower body treated, their ankle, their knee, or their hip. We'll advise you at the procedure if that's recommended for you. After the procedure, you're gonna prepare for some rest days. 3 days of rest on that affected area treated is recommended. Now, that doesn't mean that you can't get around the house, that you have to be in bed, but it just means that you're gonna limit the amount of weight-bearing activity that you do, and we'll explain that based on your procedure. You'll want to avoid flying for at least 24 hours post-procedure, if at all possible. If you have a procedure on your neck or your spine, like an intrathecal procedure or a spinal epidural type of procedure, or if you don't know if we possibly might be treating those injections into your spine, then just plan on avoiding 72 hours of flights, avoiding flights for 72 hours after your procedure. So if you have your neck or your spine treated, schedule your flight for at least 3 days after the procedure. Don't do any physical therapy or schedule it for the week or the second week after the procedure. You can get some specific guidelines from the providers when they're in the room explaining to you whether you can go back to physical therapy after 2 weeks or if they would recommend that you go back any sooner or any later. Some of the following activities that I'm gonna list will be advised that you avoid for the time period of your healing. Usually this means 8 weeks in the area of your treatment. So the following activities will not be recommended around the area you had treated: acupuncture, cupping, chiropractic adjustments, cryotherapy, heat like a warm compress or a hot tub or jacuzzi, massage, therapeutic ultrasound, the TENS unit, mobilization exercises, magnetic therapy, laser therapy, radiofrequency therapy. Usually we mention all those items are allowed to be continued on the areas that weren't treated within 2 weeks after the procedure, but not on the area treated until 8 weeks after the procedure. You can expect your pain to be a little worse for about 3 days to a week after the procedure and then get better. Sometimes there's exceptions to this where you'll actually feel amazing immediately after you get off the table, and then you might get soreness later, you might get improvement continuously. Every person is different, and that's why we expect you to come back for your 2-week follow-up exam or do a phone consultation if you're from out of town. The nurse will reassure you of the normalcy of your healing process. We also want you to avoid the amount of alcohol and smoking for 3 days after the procedure, and as long as you can for the first couple months of healing. You don't want to be doing any extreme forms of recreational drugs or smoking or alcohol, as we want you to be allowing your liver to provide your body with the growth factors and the healing that it can in response to the regenerative stimulus we provide you. Eat a lot of vegetables, fruit, and protein. We have collagen protein and bone broth protein, as well as glutamine glutamine powder. Here at the clinic, different brands are fine if you want to get it on your own. You know, things like to pay attention to when you're buying your protein is non-GMO, hormone-free, grass-fed meat, wild-caught fish, free-range chicken or turkey. Those kind of things are good to look at so that you get the best quality of protein for your body. PRP is basically PRP, placental tissue matrix, exosomes, stem cell therapy, or even nerve releases. They all really require your body to be at its optimum functioning, and you want to feed the growth factors with the solution and with the nutrients that it can really help to heal. You can use Tylenol for pain instead of the Advil or ibuprofen after the healing or after the treatment is done, but you don't want to take aspirin or ibuprofen for about 8 weeks after the procedure. If you have an occasional headache, you can use this as an exception. You can take your migraine medication or your Advil or naproxen or Midol for anything, but just don't use it as a daily pain medication. If you need something for the immediate post-procedure pain that you experience, please contact our office and we can provide you with a prescription if needed. Usually people's pain is minimal and Tylenol does the job. You can also use elevation, or you can use compression with the taping or another supportive brace or a sling if we provide those instructions for you. And sometimes ice is helpful if needed. If there's anything else you have questions about, feel free to call our office at 858-609-0866, or you can also leave a message on the nurse's line, 619-876-0700. And we will get back to you as soon as we get back in the office. We also will be seeing you at 2 weeks for the follow-up, and then we'll be examining the area that was treated. If it was used with regenerative medication or regenerative solutions, we'll be following up with you around 8 weeks to 12 weeks after the procedure. If you have any additional questions, you can always email us at info@joywellnesspartners.com, and we will get your answers to your questions. Please call us too if you have any fever or bleeding or signs of infection like redness or drainage or excessive pain not relieved with Tylenol medication. Thanks.